Stage 3 restrictions in Melbourne look to be slowing the spread, just not enough to turn this curve around. Low community compliance with self-isolation, that's clearly a problem. Perhaps if that improves, together with the compulsory mask wearing rules that begin tomorrow, that might be enough to see this curve turn around. But every day the trend is up, it increases the likelihood that that 6-week lockdown in Melbourne needs to be extended. This clearly isn't helping. The number of cases under investigation in Victoria is getting to be gigantic, more than 2,000 of them at the moment. It really seems like contact tracers are massively overwhelmed. That means there's less information now about where the virus is spreading, so it's harder to know if any local interventions would be helpful. In New South Wales, the game of coronavirus whack-a-mole is continuing. The good thing is no new moles have been popping up their heads in the last couple of days. All of today's cases and yesterday's linked to known clusters with a known source. But there are potentially hundreds of people exposed to this cluster, particularly through the Our Lady of Lebanon Cathedral, where 3 masses and a funeral last week were attended by an infected person. They've been told to self-isolate, but if people in Victoria aren't following that advice, even with hardship money available for some, how can we be sure that's happening in Sydney?